My name is b.thompson, and this is my last videotaped exam for NP 601. Do a head-to-toe assessment. I'm going to start with the head and the face. When I'm assessing a patient, I'm looking at their skin throughout. I'm looking for the color, specifically bruising, scars, lesions, nevi. I'm assessing the temperature, texture, and turgor throughout. When I'm looking at the head, I'm looking at the size and the shape. Looking for midline positioning. I'm also going to assess hair distribution, color, and texture. I'm going to start by palpating, but also looking. While I'm palpating and looking, I'm looking for infestations. I'm looking for masses or depressions, any area of tenderness or lesions. Great. I'm going to go ahead and assess the nose for it's midline, it's straight, and I'm going to have you just kind of blow through your nose. Good. We're assessing patency there. I'm going to go ahead and assess the temporal pulses. Do you have any tenderness?
Tenderness.
Along here, I'm going to assess cranial nerve number 5 with a punch your jaw. Move it from side to side. Very good. And cranial 5 also is demonstrated by light touch. And I'm going to have you close your eyes, and I'm going to touch, and you just tell me when you feel it.
Yep. Perfect. Yep. Yep.
All right. I'm going to go ahead and assess the ears, and I'm looking at symmetry. I'm feeling for any masses or tenderness in both the pinna and the tragus. I'm going to go ahead and examine the auditory canal and the tympanic membrane. I see moderate amount of cerumen, and the tympanic membrane is gray and shiny without any evidence of edema or redness. And this one, I can see that the tympanic membrane is gray and shiny. It doesn't look inflamed, but the auditory canal does look red. Are you having any pain in that one?
Yes, I am. Small amount.
Okay. So I'm going to go ahead and look at your eyes. I'm looking at the brows and the lashes, and I don't see anything irregular. I'm looking at the palpable fissures. Have you turn your head up just a little bit? And look at the conjunctiva, and the pink with a little bit of redness at the edges. Conjunctiva is pink. The sclera are white with a little bit of irritation. I'm going to go ahead and look for the red reflex. Use the right scope. Well, here I'm going to go ahead and look at the fundus. When I'm looking at the fundus, I'm noting the color. It's kind of an orangish color, and the edges are clear. And this eye looks similar. I'm going to go ahead and test cranial nerve number 2 for a gross visual exam. So I'm just going to hold up some fingers and tell me what you see. Okay? And there is a clock. Can you tell me what it says? It's right over there.
130.
Okay. I'm going to check pupillary response, both direct and consensual. So I'm going to shine this light, and it's going to go into one eye, but the other eye is going to respond also. Okay. I'm looking for symmetric response to direct and consensual light. Kind of with symmetry, the pupils are about 4 or 5 at this point. I'm going to test now for cranial nerve number 3, and we're going to look at accommodation and convergence. So I'm going to go ahead and have this little Q-tip, and I want you to look at the tip of the Q-tip. I'm going to bring it towards you and then bring it back. Just keep your eyes on it. And what I see there is that he's able to follow that and track it smoothly. Also, I can see his pupils react to the accommodation of, they're accommodating a close-up object and a faraway object. I'm going to go ahead and test cranial nerve number 3, 4, and 6, looking at conjugate gaze and extraocular movement. So follow this, please. Good. And even going in the far fields, I don't notice any nystagmus. He's able to follow it fluidly. And I'm going to go ahead and look at the throat and mouth. And when I do that, I'm going to be looking at both the teeth and the gums and the lips, the tongue, the floor of the mouth, the salivary ducts, the palate, and I can check cranial nerve 9 and 10 while I'm there, looking at the soft palate and the uvular rise, and nerve number 12, over 6 of his tongue, the midline position and black situations. So I'm going to have him open my mouth. Good. Stick your tongue out. I'm going to back in. I'm going to look to the side. I'm going to lift it up. Good. Looking at the floor of the mouth. And when you open your mouth, I'm going to use this to look in the back. Okay. All right. And ah. And good. And so he has good movement, soft palate movement, and uvula is midline. Again, demonstrating cranial nerve 9 and 10. His tonsils are quite small. I'd say in stage of adult 1. They're present, but very, very small. I'm going to go ahead and look at the neck. I'm looking at the skin again for color, bruising, any scars, any lesions or nevi, edema and moisture, temperature, texture, and turnover. When I'm looking at the neck, I'm also checking that the trachea is midline, and I can check the thyroid. I can palpate the thyroid, and I don't feel any nodules. I can palpate the carotids individually. And I'm going to do some range of motion with your neck. So I'm going to have you just flex it forward and back up. Extend it back a little and then hyperextend it back. Very good. To the side is a flexion, lateral flexion. Good. And then turn it, your chin to the shoulder. Very good. And then the other way for rotation. I'm going to just do a couple quick hearing tests on you. First is the whisper test. So I'm going to close your ear and I'll whisper something. You just repeat it.
What do you say?
Good.
97.
Okay, very good. The Weber test, it tests for unilateral hearing loss. So we're going to just put this, we're going to do this and then we'll stick it on your head, okay? Strike the cord.
Both ears.
Very good, both ears, okay. we're going to do one called the relay test, where we strike the board and we put it on the bony prominence behind your ear. And when you no longer hear it, you say now, and I'll turn it upright. You should be able to hear it like further. You tell me how long you hear, okay?
Okay. Let's do that.
Very good. Let's try this here.
Okay. Let's do that.
That is testing for conductive hearing, and it looks like yours is pretty good. Let's see. I'm gonna go to I think the posterior chest, so I'm gonna go around behind you. Okay, I'm going my stethoscope with me. I'm gonna untie your gown. When I'm looking at the chest, I'm looking at the skin again to make sure that I'm noting the color, any bruising, lesions or nevi, moisture edema, the temperature, texture, and turgor. I'm also looking at the symmetry. I'm looking at the symmetry of the posterior chest. I see no obvious deformity. It looks symmetrical at this point. I'm going to go ahead and palpate for tactile fremitus. You can say 99 for me.
99, 99, 99, 99, 99.
And that all seems normal and pretty consistent throughout. I'm going to have you take a deep breath. Good. And I'm noting the symmetry of his breaths by touching it and watching my hands move apart. I'm going to go ahead and percuss the posterior fields, and I'll start here. Oops, excuse me. Okay, and next I'm going to listen to your lungs. I'm going to have you take a deep breath for each time you feel me place the stethoscope. If you just take one breath.
Okay.
Kind of slow, so you don't hyperventilate. So I hear vesicular sounds in the upper and then more broncho-vesicular in the lower ranges. I'm going to listen one more to make sure I get the right middle lobe. Yes, good air excursion. I don't hear any adventitious noises. There's nothing abnormal about his respiratory rate or pattern. He doesn't look to be in any distress at all. His positioning is very comfortable. He's not tripoding. There's no nasal flaring, there's no cyanosis, there's no accessory muscle use or retractions, and I think that's, I would like to listen also, egophony is, is where you will say the sound E like this. I'm going to listen on both sides. Okay?
Now.
Go.
E, E,
Again.
E, E.
Cool. Bronchophony is I'm going to listen to you say, I'll have you say 111, and I should be able to hear noise, but it should be really clear. So go ahead.
1, 1, 1, 1, 1, 1, 1.
Good. The last one is whispered ventriloquy. I'll have you say 1, 2, 3 quietly and whisper. I should not be able to hear it clearly or distinctly. So again. 1, 2, 3. And 1, 2, 3. And I'm going to do that again. 1, 2, 3. 1, 2, 3. Okay. And that seems normal. I'm going to go ahead and go around to the front again and look at the front chest, the anterior chest. And we're going to lower your down, so I'll go ahead and give you this for your legs. So I'm looking at the skin for any, I'm looking for the color, any bruising, any scars, any lesions nearby. I'm looking if there's edema or moisture, and the temperature, texture, and turgor. I'm looking at the symmetry of the chest. See no obvious deformities. It does look symmetrical. I'm going to go ahead and palpate the chest with expansion. So go ahead and take a deep breath. Good. And I'm going to go ahead and palpate for tactile firmitas and any tenderness. Okay. So. And your brain.
999. 999. 999.
How about 99 straight out?
99.
Good.
99. Yeah.
Okay, so that seems pretty regular, minimal firmitas, honestly. And did you have any tenderness or anything like that?
No.
So I'm going to percuss the lung fluids, and then I'm going to listen to the lung fluids. Okay? So I'm going to this way. We can go ahead and listen to the intercostal spaces. And that takes maybe just one. Normal lung sounds, good air excursion. I hear no adventitious noises. I'm going to go ahead and start on the heart assessment now. So I'll start with auscultation on this one, and I'm going to listen to the valves. So I'm going to listen to the aortic, and then the second intercostal space, the pulmonic. Also with the second on the left side of the chest. Erb's point is at the third intercostal space. And here S1 and S2. And then tricuspid is at the sternal border on the left. And then the mitral is intercostal space 5. And I'm going to palpate for the point of maximum impulse, the apex of the heart. gonna listen for 1 full minute. It's a regular rate in rhythm. Sounds very good in rhythm. I'm going to go ahead and have the patient lie down. So I'm going to help you move this bed first, okay? I'm going to lie down. I'll help you with your covers. I'm going to raise this bed up. I'm going to go ahead and inspect for any heaves or lifts. And then, there we go. And I'm palpating the precordial area. And I don't feel any heaves or lifts. I'm going to go ahead and palpate for thrills in each of the 5 areas. In the aortic. Pulmonic. Herbs point. Mitral. I'm sorry, that was tricuspid and mitral. Okay, and I feel none. I'm going to go ahead and listen. Again in the aortic. The pulmonic. They're in the process space for herbs point. Okay, that's one ST as well. And then external border, I can hear the tricuspid. The fifth and also space the mitral. And I'm gonna again palpate for the PMI. Listen for 1 minute. Okay, and that sounds really good. I'm going to go ahead and move on to the abdomen. I'm looking at the skin again. The skin color, and then we're losing scars, lesions, nevi, the evidence of edema or moisture. I'm noticing the temperature, texture, and turner of the skin. I'm also looking at abdominal contours and symmetry. She does appear symmetrical. I'm going to listen to the buoys, the aorta, and the renal arteries. Start with the aorta. And the renal arteries bilaterally. The iliac arteries. And then the femoral arteries. I'm going to listen to vowel sounds in all four quadrants. In the lower right. Upper right. And lower left. I hear normal vowel sounds throughout. If I thought that perhaps there were no vowel sounds, I would be sure to listen for 4 or 5 minutes before determining if there were none. I'm going to go ahead and percuss the 4 areas, and then I'm going to palpate. I'm going to come around to this other area because I hear back very much to the camera. So you just relax. I'm gonna percuss. There's an area of dullness where we have solid organs. A little bit more to where the air filled ones are. I'm going to palpate for tenderness, and I'm just going to start up here. Relax your abdomen and tell me if there's anything that's uncomfortable. Okay. I'm going to palpate the number. So I'm going to slide my hand in here. You don't really have to do anything, but I just want you to know what I'm doing. Now I'm going to get up here. I don't feel any masses or nodules. Doing okay?
Yeah. No problem.
I'm going to do the same technique over here. Feeling for the skin. Relax, please. Great. Feel no masses. Can't really feel a spleen either, but I think that's normal. I'm going to have, I'm going to do the JVD row, but in a lying position. So, I'm turning it this way. See. You can see the distension. I'm going to bring that to about 30. Just relax your head, please. Patient. You can see it at 30 and it's for 5 days more upright. I'm going to go ahead and sit forward away. I'm going to press back here a little bit. Any tenderness here?
Oh man.
I'm assessing for costovertebral angle tenderness. And now we'll do the upper extremity. So I'm going to come around again here. And if you like, you can try and sit on the edge of the bed and put this back on. All right, just don't fall out there. Got you up in the air. I'm looking at the extremities, I'm again looking at the skin. I'm looking for anything abnormal. I'm assessing the general warmth and the integrity, but I'm looking for any bruising, scars, lesion, nevi. I'm looking for color, moisture, temperature, texture, and turgor. I'm going to go ahead and look at the hands first, and when I'm doing that, I'm assessing symmetry, and they both look symmetrical. I'm feeling for any areas of warmth. I'm looking for redness, swelling, any deformity, any nodules, or areas of tenderness. Do you have any areas of tenderness? Okay, so I'm going to have you grip. Very good. I got a bite strength there. We're going to do a little range of motion on our hands. So I'm going to have you flex your fingers, extend them, hyperextend them, which they are. I'm going to have you abduct them, and adduct them, and I'm going to have you touch your thumb. Perfect. I'm going to check if that's good. Thank you. I'm going to check your calf refill. That's very good. I would say less than 2 seconds even. Alright. And I'm going to go ahead and move up to the wrists. And again, I'm looking for symmetry. I'm feeling for any crepitus, areas of warmth, swelling, any nodules or area of tenderness, and they look good. Any tenderness there. I'm going to have you flex at the wrist. Good. And extend. Very good. You can hyperextend. And then I'm going to have you turn them in. Good. And out. There. Okay, so you've got pretty good range of motion there. I'm going to go ahead and look for, I can do the rotation. Let's do the rotation. Thank you very much. I'm going to go ahead and look at the symmetry of your elbows. Good. Bend them for me. Excellent. And I don't notice any, they look symmetrical. I don't notice any redness, warmth, deformities, nodules, crepitus, or areas of tenderness. I'm going to go ahead and have you extend them and then hyperextend them. Good. Very good. And we'll do the strength one now. So I'm going to have you put your arms up like this and push. Very good. Now I'm going to pull back from off this. Good strength. I would say 5 out of 5 strength there. I'm going to again, I'm assessing the shoulders for symmetry. And look again for any redness, deformity, nodules, crepitus, or areas of tenderness, and everything looks good here. Go ahead, shrug your shoulders up for strength. Good. And again, it's very strong. 5 out of 5. I am going to assess for range of motion again, but I'll tie it up. So this one for range of motion, we'll flex them forward. Good. And extend them back. And hyperextend. Very good. I'm going to have you do the rotation where you cross it. So right here. Good. And out. And same with the other arm. The rotation of that. And then you're stretching out. That's good. That's very good. Range of motion. So the next one would be abduction. Like this. Good. And adduction. Very good. And circumduction, or rolling the shoulders. Very good. Excellent. I'm going to go ahead and test for light touch and have you close your eyes, please. Okay, and tell me when you feel me touching them.
Good. 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 Yes.
All right.
Yes.
All right. Very good. I'm going to go ahead and test the one where you have your eyes closed, and I'll hand you an object, a familiar object, and you just tell me when it is. So put one, hands up, please.
Remote.
Yes, it is. Keep your eyes closed, and do that one more time with the other hand. Okay.
Rotate.
Yep. This other one is also with your eyes closed. I'm going to have your palm, and I will scratch a number into it so that you can write it on your hand. This one's called graphexegia, and you just tell me what number it is, okay?
3.
Good. I'll move the other hand, okay?
4.
Very good. Then we're going to do a coordination one. So I'm going to have you, your hands on your thighs and then flip them over. Back and forth, back and forth. Very good, very good. Okay, so then the other one is the opposable opposition. There you go, finger opposition. Excellent. Very good coordination. I'm going to do the finger to finger. So I'll hold up my finger and you reach out with this hand first, and then the next time I move my finger, you reach out with the other hand. Okay, so go. Sorry, I'm not very good at this one. You're better than I am. And then we're going to do the deep tendon reflexes. Everybody's favorite part. We're going to start with your arms, actually. So, and then have you just kind of rest your hands. Okay, and I'm going to do this one here, so yep, that's right, just rest your arm. Okay, I'm going to try this one. Try, do your best to relax. It's hard, I think, for people to relax during this. So your arm just kind of hanging. So probably a 2 plus, I wouldn't say they were brisk. Okay, good. Rest this arm. And again, this last one, just relax and let it hang. All right. And I think that's everything for the uppers. I'm going to go ahead and do the lower extremities. I'll go ahead and start with the toes. When I'm looking at the toes, I'm also looking at the feet. I'm looking at the skin for warmth and integrity. And I'm going to go ahead and bring this down so you kind of see us, I think. Okay. So I'm going to look at your toes, and I'm looking for any redness, swelling, deformity. I'm feeling for any nodules or crepitus or areas of tenderness. All okay?
Okay.
Really good. I'm looking here. I'm looking for at the skin for the any wetness or edema, down, that kind of stuff. So I'm going to go ahead and have you adduct your toes. Great. And let them come back together. Flex them down. Good. Extend them up. Really good. All right. So I'm going to go ahead and do the same for your ankles. I'm feeling and assessing. I'm looking for symmetry, looking for any deformity, feeling for any warmth, looking for redness, feeling for crepitus, or nodules or areas of tenderness. I'm going to go ahead and have you raise your ankles up in flexion and then extension and roll them around a little bit. Good. And then I think, invert them, or invert them, there you go, good, and then out, perfect. Very good, good job. It is hilarious to you, isn't it?
Yeah.
Okay, so I'm going to do the Babinski reflex while I'm here, so you just kind of relax, let go, I'm holding your leg, okay. And I'm going to scratch up, good, let's try that again. And a little flaring there, we're looking to see the reflex, which the normal reflex is to kind of bring your toes down if there's flaring or the toes go up. That would be abnormal. You're going to feel for your pulses really quick. Just relax, please. Thank you. Very helpful participant. And posterior tibial. There's Alice penis and the posterior tibial. I'm going to go ahead and let you relax. And we're testing our reflexes again. Maybe a +1 there. Boy. I'm going to go ahead and assess the knees now. When I'm looking at the knees, I'm again looking for any redness, swelling, deformity. I'm feeling for any crepitus or nodules. I see one and they're symmetrical. I'm feeling for popliteal pulse. I'm going to have you extend the legs, good, and pull them back, good, and start good strength and movement in his knees. I would say 5 out of 5 strength again. I'm going to go ahead and have him go ahead and bring your legs in. I'm testing hip strength, good, and out. Again, 5 out of 5 strength, and no match. We need pain or anything.
Okay, that's fine.
Okay, great. So, oh, I did forget one thing. This one's fun. This is the tuning fork. We're testing for vibratory sense. I'm going to strike the fork and put it on your malleolus, okay? I'm not very good at striking the fork. Feel the vibration?
Yours is good.
There we go.
Oh, yeah.
You want to feel the vibration. Okay, here it comes.
Interesting. Good.
All right, there we go.
Don't see more. I'm just the ankles just over the head.
I think I missed the wrist ones too. Can do that.
Okay. Good.
It's pretty cool, huh?
Yeah.
Okay. So we're doing the hips. And I think now we need to actually look at the hips. So I'm going to bring you back down to earth. No falling allowed here. You tied up in the back.
Oh, thanks, one.
Okay. So this is almost showed your hiney. Okay. Let's turn you this way, okay? So I'm going to inspect and palpate the hips at this point. And I'm looking for symmetry. I feel no deformities or swelling. Are you having any tenderness or anything?
I don't know.
Okay, there's no crepitus or nodules that I can feel. I'm going to go ahead and have you do some range of motion stuff. So you're going to flex your hip, maybe bend it hip, good. The other one too. Got good balance. Okay. And you're going to extend it behind you. Good. Excellent. Other one. Very good. And now I'm going to have you bring your hips. You're going to abduct away from the body. So you're going to bring your leg out. Very good. Other one. Good. And when you come back in, they're abducting. Watch your bones.
And that's good. Trying to make sure.
Okay, and then we're going to do an external rotation. We turn your feet out. Excellent. And then internal rotation in. Very good. And I want you just to do a little bit of a circular movement. Very good. You have great balance. Since you're doing that, why don't you hop on one foot for me? Good. Hop on the other foot. Oh, you're a character. Okay, I'm going to have you stand like this and put your feet one in front of the other. Good. I'm going to walk across there and then come on back. Excellent. Do the tandem walk. Okay. And he has a normal gait normally. Go ahead and walk across normally and then back. And then I think we have a Romberg test. Good. Smooth gait. Good coordination. And so this one, I do want you to put your feet like this again. Put your hands out and just keep your eyes closed for 20 seconds. And look. Uh-oh.
What does that mean?
Nothing. This is just the more complicated Romberg test.
Why am I off balance all of a sudden?
I don't know. Do your feet just side by side. That's fine. And stick your hands out. No, you don't have to do that.
Okay.
just side by side. There you go. Perfect. I was giving you the complex one since your balance was so good.
I know we have to do that at some point.
Very good. I think we got it all. And I'll thank you for your participation and thank you for your time and endurance during this painful experience.